the top kidney pain causes and symptoms you should never ignore. So yes, in my practice, many patients come to me complaining of kidney pain, and they have various symptoms that really are just huge hints, huge warning signs of underlying kidney disease. And so what I would like to do in this video is to empower you so that if you're having kidney pain or if you're having certain symptoms, you can have a good idea of what's serious, what's not, and when to call your doctor. You definitely don't want to ignore some of these symptoms because having them and having the underlying cause of the symptoms could lead to kidney failure. Kidney trauma or kidney injury can definitely cause kidney pain. And all kinds of things can lead to kidney trauma. You can have a car accident, blunt force trauma. If you're somebody who's into martial arts, or if you're just in a fight and you get knocked in your kidney, okay, that can cause kidney trauma. And certainly gunshot wounds or stab wounds to the kidney, that's going to be traumatic and can cause kidney pain. The important thing is this: knowing when to go in to see the doctor. A lot of times when you have a car accident and the policeman comes and the fireman comes, they offer you to go to the ER. A lot of times after a car accident, your adrenaline's running, you don't feel any pain, you don't know what happened. But if you are having kidney pain after a car accident or some type of a blunt trauma, you want to make sure that you consult with your physician or go to the ER to make sure that your kidney injury does not need some type of a surgical intervention. Kidney cancer is another potential cause of a kidney pain. Now, typically, kidney cancer is silent in many cases, okay, meaning there are no symptoms. You can be asymptomatic. But kidney pain, in some cases, actually can be a symptom of kidney cancer. It can be flank pain, side pain, back pain. Now, the kidney cancer, renal cell carcinoma, that's the most common cause. And while we don't necessarily have one pinpointed cause of the kidney cancer, with renal cell carcinoma, there are some associated risk factors. For example, if you are a cigarette smoker, you are at a higher risk for kidney cancer. Also, if you're a person who's living with obesity, if you have high blood pressure, that is a risk that could be associated with kidney cancer. Also, if you have a family history or if you've been on dialysis long term, that's another risk factor for kidney cancer. In addition to kidney pain, some of the other kidney symptoms associated with kidney cancer in some cases include the hematuria or blood in the urine. You can also have hypertension, night sweats, unintentional weight loss. Renal vein thrombosis, okay, another cause of kidney pain. And that is when one or both of the main renal veins that drain the kidneys get blockages. And this typically will happen if someone has a blood clotting disorder, like where their blood gets very thick, where it clots very easily, okay? Or if they have something called nephrotic syndrome, which can lead to a hypercoagulable state or blood that clots. And basically, instead of the blood draining nicely from the kidneys and going to the inferior vena cava and going the way it's supposed to go, you just get a big old clot there, okay? A renal vein thrombosis, and it can definitely cause pain, like a flank pain. It can also cause blood in the urine or hematuria. So just remember, another cause of kidney pain could be renal vein thrombosis, especially if you're someone with a history of a clotting disorder or even lupus that leads you to have a hypercoagulable state, or nephrotic syndrome, minimal change syndrome, someone who's been told you're leaking a lot of protein in your urine. If you have any of these diagnoses and you have kidney pain, just think renal vein thrombosis could be a possibility. Consult with your physician right away. Autoimmune diseases. Certain autoimmune diseases can actually lead to inflammation of the kidneys and cause kidney pain as well. That's kind of a little known fact. So autoimmune diseases are diseases where your body's immune system, instead of just fighting the bacteria, viruses, and the foreign invaders that it's supposed to fight, autoimmune, your body's immune system turns on you and starts fighting you. Like an autobiography is a book about oneself. An autoimmune disease is a disease that fights oneself. Some examples are lupus, IgA nephropathy. So with lupus, you can get something called lupus nephritis, where you get inflammation in the kidneys. And if it happens like acutely or rapidly, or the kidneys swell, it can cause kidney pain. It can also cause hematuria or foamy urine as well. Also with the IgA nephropathy, that's something else, that when you get that glomerulonephritis, that inflammation, it can cause pain on one side or both of the kidneys. It can also be associated with foamy urine or Coca-Cola colored urine, blood in the urine. Certainly, if you're having any of these symptoms, contact your physician immediately. When you have these autoimmune diseases like IgA nephropathy, lupus nephritis, in some cases, they can also cause a swelling of the hands and of the feet. And this is edema. So edema is if you get swelling or fluid in your tissues, like in your hands, your feet, your ankles, your legs. And oftentimes, if you press your fingers down, like on your legs or your feet, it might leave a pit, right? It might leave an imprint of your hand. And in that case, it's pitting edema. Nephrotic syndrome that I mentioned earlier, when I said that renal vein thrombosis can be associated with nephrotic syndrome, that's something else that can be associated with edema. And that edema tends to be generalized, like your whole body is swollen. Now, I've covered definitely the top kidney pain causes and the symptoms you should never ignore, but I will say there are some questions that I get asked frequently about kidney pain. One is, can dehydration cause kidney pain? Now, classically, dehydration won't cause kidney pain. However, if you get severely dehydrated, that can increase your risk for kidney stones, which of course can cause kidney pain. It can also increase your risk for renal vein thrombosis, which can cause kidney pain. So that's the link with the dehydration. Another question I get commonly is UTIs, urinary tract infections. Can they cause kidney pain? Yes, definitely. The urinary tract infection, it may start off in the bladder or like cystitis, but if it ascends up to the kidneys causing pyelonephritis, then definitely kidney pain can ensue. Another important question that I get asked frequently is kidney pain versus back pain. How can you differentiate? And honestly, they can be very similar, right? They can both be in that costovertebral angle, kind of right down there below the ribs and your flanks and where the love handles are. And how do you know if it's like a muscle spasm or something that's being caused by a pinched nerve or herniated disc versus is it your kidney? Well, the main way to know is by checking the urine. If you want to differentiate between the back pain and a urinary tract infection, you should see your doctor and ask for a urinalysis with micro, okay, where they can look for white cells or signs of infection, and also a urine culture to see if there are bacteria growing. If you have a pinched nerve and back pain, like from muscle spasms, that is not going to be the cause of bacteria growing in the urine. So yeah, a urinary sample, a urine culture is how you can differentiate, but definitely consult with your physician.